I'm joined by two of the GPs involved in the project, Dr. Samantha Fee and Dr. Daniel Israel. Good evening to both of you. Thank you so much for joining us. Sam, I'm going to start with you. How has life changed at the average GP practice since lockdown?
Sally, good evening and thanks for having us. It's lovely to have a platform for our message. I was thinking about this question earlier, and I think for me personally, something that has always been a very safe and familiar space has started to feel very unsafe and much less familiar. I think, like the lockdown, general practice has gone through various stages. And the first stage was one of fearful anticipation, watching what was going on overseas before we'd even had our first case. And then this unbelievable information overload, which I know that the community has experienced too. And that meant that we were working very, very hard to try and understand as much as we could about something that no one really did understand, and then get ready. And, you know, when I walked out of my practice this evening, it's a very different place to what it was 10 weeks ago. Yeah. My reception staff are boxed in a Perspex box. There are no toys in the waiting room. There are no fabric sofas. There are no flowers. My patients, when they do arrive with fearfulness and apology. And I think most of us have experienced a significant reduction in patient visits, on average about 75%.
And Daniel, that's a big issue, and of course there must be financial implications, but I want to bring Dan in here. Are patients staying away from crucial health checks? I'm thinking of vaccines for babies, you know, important yearly checkups for things like cancer and that sort of thing. Are you seeing that those important health checks are being missed in your practices?
Absolutely, Sally. For not only health checks, but also just routine preventative health measures that they should be taking, and just they seem to be neglecting day-to-day problems. I've just come back from our practice now, where I've seen a patient who perhaps if we had intervened a little bit earlier, we could have got him in a better place sooner. So we're seeing this coming out now slowly, and it's an accumulation of what's been building up the last few weeks.
And Sam, back to you. Are you finding that patients are bringing you their anxieties? I know that you are a family practice and you deal a lot with parents and with children, and we're talking about getting kids back to school, and there's so much information, as you said. Are we having a situation where people are actually coming to you looking for guidance, and what sort of information are you sharing with them about opening of schools, for example?
Absolutely, Sally. So we've seen an influx from the beginning of anxiety. If I look at my spread of diagnoses, the anxiety and the counselling, and even as far as depression that we're dealing with now, is definitely higher than normal. And then we have our patients who are coping really well with lockdown. Maybe the average South African is coping, but they are perplexed with the questions. And I'm dealing with questions on a day-to-day basis. Before school, it was about how to keep safe. Now it's about when to send your kids to school, how to send your kids to school. As a group of GPs in Johannesburg, we've made a commitment to take the information that we give out from the evidence that exists out there. So we on our WhatsApp group, we share evidence-based studies, and we share that with our patients.
In an effort to keep everyone informed. Samantha Fee, I'd like to bring you back in here. Now, you too deal with parents all the time, so I'd just like a little comment on that. But then if you could also just tell us a little more about the song that you got roped into. It's an incarnation I'm not used to seeing you in, but it really is a lovely video. But talk to us first about, similar to what Dan has said, Sam, tell us a little bit more about what you're saying to parents, and then tell us about this lovely idea of Dan's.
Sally, I think nothing fuels free-floating anxiety more than not knowing enough about something. And that is the frank reality of what we're dealing with at the moment. We as GPs are used to being the purveyors of knowledge and the reassurers because we've got an answer. And a lot of the questions our patients are asking us now, we don't have a frank answer to. So we are, as Dan said, reverting to evidence-based science, and we are looking to our colleagues overseas to learn from them. But the anxiety that parents are feeling at the moment is very valid, and we are respectful of that and gentle with them about it. each child, each parent, each family and each school going situation needs to be dealt with in its own individual capacity. And we are encouraging parents and their children to come and see us and talk through the fears. And together we're trying to come to a middle ground that feels reasonable and safe for everyone involved. We're encouraging parents to trust the processes that the schools have put in place. No one at the schools wants to get sick. None of the teachers would like to get sick. No one wants their children to get sick. And they've worked extremely hard in the last weeks to put measures in place apart from just social distancing, hand washing, sanitizing our hands and wearing masks. And I think at some point we're all going to just have to block our noses and jump in.
Absolutely.
And
Samantha?
believe everyone's doing their best.
Absolutely, and thank you for such a lovely message. We don't have time to play the song, so I'm actually just going to sneak in 10 seconds, if we can just have a 10-second listen of that song. But thank you very much, Dr. Samantha Fee and Dr. Daniel Israel. We'll play a little bit of that song and then take you to our weather news.